Okay, now I'm going to show you a short sequence that you can do in your chair. So you can do it at the office, maybe at lunchtime, or if you have a few moments in between patients, you can do some of these moves. It helps with the static postures we were talking about earlier. So it doesn't matter what kind of chair you use, this is just a folding chair, but sit forward and tall. So you don't want to slump back and touch the back of the chair. You're sitting forward in the chair, your back is long, your neck is long, and imagine your head going towards the ceiling. And just breathe, take some slow, deep breaths, or natural breaths. Just bringing your attention to what you're about to do, into your body, and see if there's anything that's sore or tender. You can open your eyes or leave them closed, whichever you like. And just slowly let your head just roll in circles, gently. Again, you can leave your eyes open or close them. As you come forward, you inhale. And as you go back, you can exhale. And go the other way. Breathe in whatever way is comfortable to you. And then come to stillness in the center. Let your head float gently to the left and extend your right arm down by your side and lower your shoulder and reach your fingers towards the floor. As you let your head just float to the side for a little stretch, you'll feel it all right here. If you'd like to take 2 fingers with a gentle, very gentle touch on the side of your head, that deepens the stretch a little bit. And breathe. And as you exhale, you can turn and look down towards the floor. And then if you'd like to, you may, on your next exhale, look up towards the ceiling. I don't do that because it doesn't feel good on my neck. It's not comfortable. So I'm going to stay here, but that's just an added stretch if you want to look up. And release, come to center. And we'll go to the other side. So just let your head float to the right. Extend your left hand down, reaching towards the floor. And if you'd like, you can leave your hand here. Or if you'd like to take your 2 fingers to the side and just press gently. And exhale, look down. And inhale, look up if you want to. And release. And come to center. So our spine moves in 6 directions. So we're going to move those directions right now in the chair. So the first way we're going to move is through the frontal plane. So we're going to go forward and backward. I'm going to turn sideways a little bit so you can see what my back is doing. But you can stay forward. Just place your hands on your knees. And as you inhale, come forward, bringing your shoulder blades together and down your back, and come forward with your chest, arching up. And then as you exhale, tuck your chin under, push your hands into your legs and arch your back. And inhale forward. Exhale, release. Inhale, come forward. Exhale, tuck your chin, press into your legs, and come up to center. Now take your right arm and reach it up right by your right ear. Draw your shoulder down because our tendency is to reach our shoulders up, but we want to bring our shoulder down, but reach our fingers long. Place your left hand on your right leg, just rest it there. Inhale, reach, exhale, lean to the left, stretching all through the side. Inhale, come up center, and foot to the other side. Inhale and exhale. And now gracefully float to the other side. Do it again. Stretching all through the side. Inhale as you come up, bring both arms up, and we're going to twist to the left, and you're going to take your right hand to the outside of your left knee, and your left hand can do whatever. You can lean it over the back of the chair or grab behind the chair, but you're going to press, keep this hip down and press into a twist. Inhale and exhale here. Inhale, bring both arms up and float to the other side. Inhale up and turn. Inhale up to center and twist to the other side. And come to center. Now take your right ankle and place it over your left knee. This may be difficult for some of you with tight hips, so you can walk your left foot out a little bit to give yourself a little more room, or you can not bring your foot as far, just kind of hold it in place. If you're here, flex your foot. Make sure you're still sitting tall, belly in and back is long. And this may be enough of a stretch for you. If it is, stay here and breathe. You can take your hand and press a little bit on your knee if you want. But if you'd like to go a little deeper, inhale. And as you exhale, forward fold, leading with your chest. This is not the move. It is leading with your chest forward and pressing your hips back. Inhale and exhale. Inhale, come up. And we'll switch to the other side. This is sit tall. Come to whatever position is comfortable for you. And I'm going to turn this way so you can see like what my back looks like. You inhale. We're not arching forward. We're coming forward with a flat back. Pressing your hips back. And take a couple breaths here. However far down you come is fine. Wherever you feel the stretch, take care of your body and don't go too far. Inhale, come up and release your foot. I'm going to move the chair out of the way a little bit and come to stand. But we can use the chair as balance. So I'm going to turn a little sideways too so you see what I'm doing here. We're going to stretch through our hamstrings. You're going to take your right knee and bend it. Take your left hand and try and grab your foot at any place you can reach. It depends on how tight you are through your hamstring, through your quads here. So bend your knee, but what we're not doing is like this, okay? Because it's torqued here and here. So you're aligning your hips and your knee, and you're pushed like energetically drawing your knee towards the floor as you draw your hip forward. So the movement is not this, it is hips forward and knee down. Back is long. Breathe. Couple breaths here. And release. And then you can go to the other side. Now, if you want to try this as a balance pose, you place all of your weight into your right foot, find a point to focus on, bend your left knee, get your alignment, and then bring your hips forward and your knee down. And breathe. And release. And now take your hands, you're going to clasp them behind your back. This. Draw your shoulders back and down and extend your arms long. Inhale, and as you exhale, forward fold, lifting your arms away from your back, bending your knees, and lifting your arms as far as comfortable. Some people this is really easy and some people not so much. You can lift them as far as you can. If you want a little more of a stretch, clasp your fingers so that the palms touch together. And however far, again, it may only come this far, that's okay. And release, come to stand. Inhale, bring your arms straight up in front of you. Exhale, reach behind you. Now we're going to clasp our hands in the opposite direction behind us. Shoulders back and down. Inhale. Exhale, forward fold. One more time, bend your knees. Let your head just hang. Breathe, inhale and exhale. And inhale, come up to stand. Exhale. Inhale, this time bring your arms behind you. Exhale, bring your arms back to center.